Welcome to the Rural Wellington Low Back Pain Program education session, where we will talk about general information for low back pain, like who is most likely to get it and what causes the pain. Let's start with who gets back pain. We see back pain in all ages, genders, shapes, and sizes. People from all types of work and lifestyles, from those who are working in heavy physical labor jobs like a mechanic or a farmer, to those who sit at a desk all day, as well as those caregiving for others, like nurses, teachers, and family members, and more. Every year, 4 out of 10 adults will experience an episode of back pain. The intensity or type of pain and length of the episode will vary from one person to the next. Most adults will experience an episode of back pain at some point throughout their life. While we are all at risk of experiencing an episode of back pain, there are some things that can increase your risk. Some examples of these things that may make you more susceptible to an episode of back pain or increase the intensity of your back pain include engaging in tasks that require a lot of repetitive heavy lifting and bending or working in awkward positions, having other diseases or chronic conditions such as diabetes or asthma, genetic predisposition, high levels of stress that are not managed properly, as that is something we carry in our bodies and can heighten our pain, not getting enough rest, and other lifestyle factors such as smoking, sitting too much, or poor diet. While all of these things can increase the chance of you experiencing an episode of pain, none of these factors are guaranteed to cause back pain. The cause of someone's pain is very individualized and impacted by their overall demands on their body, both mentally and physically, and their overall capacity. Although some of these factors we are not able to modify, such as our genetics or other chronic conditions, a lot of the factors discussed here are modifiable. For example, finding ways to help manage your stress or to get up and move more often, breaking up your sitting time. We can actually implement strategies to help reduce our risk of experiencing back pain or to help decrease the intensity of the pain we experience. For more tips on managing your back pain and decreasing your risk of flaring your pain, see the other sessions in our education series. What is back pain? The vast majority of people with back pain have what we call benign back pain. Benign means that it is not dangerous and that it is not going to cause other health concerns or death. You will not die from benign back pain, but benign back pain can have a serious impact on your everyday life, including your ability to do your job, participate in your hobbies, and your overall quality of life, both physically and mentally. About 90% of all back pain is benign and is also called nonspecific back pain. Benign back pain is from muscles and joints in the back. The pain can include pain in the back, the buttocks, or the legs, as well as sleeping or tingling sensation or numbness in those same areas. Benign back pain often causes restrictions in regular movement or positions, leading to difficulty or fear carrying out our regular tasks and activities. Each individual's experience with back pain is unique. We often see pain intensity varying. As seen in the first image, a majority of back pain comes and goes and can fluctuate in intensity and duration. Often episodes of back pain are followed by times of being completely pain-free. The second image shows an episode of low-level, constant pain that then flares up and down from there, but never really going completely pain-free. In this case, we typically see someone with low-level constant pain that will fluctuate from day to day or week to week. Rarely, someone will experience completely constant pain. Many factors can impact the cycle and intensity of our pain, such as the time of day, what activities we have done that day, stress we are experiencing, and the positions we have been in, and more. Even if back pain is well managed, We expect to have flare-ups from time to time. This is normal, and at times we aren't able to identify the reason for a flare. It is really important to note that just because your back pain flares, it doesn't mean you are back to square one or that your pain is going to be worse for a long period of time. Most flare-ups of back pain resolve within 2 to 8 weeks. You can help to control these flares by developing an individualized self-management plan that you can apply when you are in a flare. We can get back to our normal quite quickly after a flare-up, using strategies to help calm the pain. Each person's self-management plan is unique. We will have more guidance on developing your self-management plan in our other sessions in the series. So where does back pain originate? When we are experiencing back pain, we want to know where the pain is coming from. However, there often isn't an obvious structure causing the pain, as there are many tissues working together in our back. There are a lot of different types of tissues in the back that are layered over top of one another. They include the vertebrae, which are the bones that form the spine, discs that sit between the vertebrae. Think of it like a jelly donut. It's a bit squishy, and it provides cushioning and allows the spine to bend and move. Cartilage that line the bones at joints throughout the spine. The cartilage helps to reduce friction and movement resistance, allowing our joints to move smoothly. Ligaments, which are a connective tissue that help to bind the bones together and stabilize movement. And layers of muscles and tendons. The layers of muscles vary in size, with the smaller muscles closest to the spine and the bigger muscles layering on top, running in different directions. The muscles control our movements and are attached to the bones through tendons. Each of these structures has their own role to play to allow us to function. Back pain rarely comes from one particular structure, and it is often difficult to identify which structure is causing the pain. Fortunately, it is not important to know exactly what structure is causing the pain to be able to provide treatment that reduces symptoms and increases your function. So what about imaging? When we are experiencing back pain, we often want answers for why we are having pain, and we ask for an X-ray or MRI to get those answers. Unfortunately, this imaging will typically not give us the answers we are looking for. Many studies have scanned people's backs of those who are not experiencing back pain, and their imaging will show the same problems as those experiencing significant back pain, including herniated discs, degenerative disc disease, and arthritis, often referred to as osteoarthritis. Studies have shown that degenerative disc disease is present in 40% of people under the age of 30 and present in 90% of people between ages of 50 and 55. A study where they took 20 to 22-year-olds with no back pain and did imaging on them, 48% had at least one degenerated disc and 25% had a bulged disc. There has been no link found between degenerative disc changes seen on an X-ray or MRI and low back pain. Not only are majority of imaging results unhelpful, but research has actually shown that they can be harmful to our mindset while trying to heal. Studies have shown that abnormal findings have led to patients having more doctor visits, longer lasting pain, and more disability than those that did not get imaging. Imaging results do not show why a person is in pain and do not determine which type of treatment an individual will benefit from. Imaging should be reserved for when a disease of the bones of the back is suspected, or if the surgeon is considering or has decided to operate. Have you heard the phrase, motion is lotion? Our body is built to move, and that includes our back. In benign back pain, we see that the movement patterns of the back change, and that some muscles and joints work too little, while others do too much because they are compensating. Many people with back pain move rigidly, gently, and slowly, moving in ways that seem protective. And although this might seem helpful, the back needs to move as freely and naturally as possible. Moving naturally, with a variety of movements, can help to reduce pain. Think about whether you avoid movement or do things differently. For example, if you need to pick something up off the floor, take clothes on and off, get in and out of your car, or the like. Try to challenge yourself. Slow things down, pause, and pay attention to how you move, and try to move as naturally as possible on a daily basis. Remember, motion is lotion. Thank you for participating in this session. I hope you now better understand your back. For additional information on managing low back pain, see the other sessions in this series or reach out to your local low back pain team. Thank you.